back on MD-VOD, and we're going to take some of your questions live online with Dr. Akash Bajaj, the chronic pain expert. First one up on Facebook is Jenny22. I am constantly getting pain in my neck and back due to my work. Is there anything specific that I can do to alleviate the pain or prevent it altogether? Great question.
That is a great question. And ultimately, posture and positioning is very underappreciated in our jobs and our occupations. If our job really requires us to maintain a certain posture or certain positioning for prolonged periods of time, over time this can definitely accentuate chronic pain or lead to chronic pain where there would be none before. I see this a lot with people who work at computers, typing, for example, weight-bearing activities for prolonged periods of time. It's very important to be mindful of your posture to the best of your ability. Don't trivialize this because this is very, very important.
Wow, so posture. Wow, great point and good question. Next up is lovely Lisa. I know that there are over-the-counter pain medicines such as acetaminophen, aspirin, or ibuprofen. Are there any others that you would recommend?
It's a great question, but it's very difficult to answer that without, again, knowing the diagnosis so we know how to treat the diagnosis. Many of the medications that were mentioned include anti-inflammatories, which are appropriate for inflammatory-based chronic pain syndromes. But again, you're best off to see your physician and get an accurate diagnosis.
Good answer and great question. Sarah Kate 87, what about being emotionally upset or depressed over the pain? Can that be a symptom or make it worse?
There is no doubt about that. The answer to that question is a yes. It's an unfortunate feedback loop where a patient may experience chronic pain. Let's say an athlete who was very active previously, now they're unable to perform their normal activities, they become depressed. On a physiological level, this has been proven to actually augment the chronic pain pathways. So definitely seek appropriate psychological care as part of your pain management protocol.
Wow. Those are great questions, and I hope you enjoyed our show here today about chronic pain, here with outstanding chronic pain expert, Dr. Akash Bajaj. Thank you, Dr. Bajaj, for joining us.
Thank you. It was a pleasure.
Thank you so much.